welcome back to Inmates Wellness. I promised everybody some information today that generally everybody needs, and so what I'm going to do is share these bits and pieces as fast as I can and as efficiently as I can without trying to get too technical about everything. But the gist of it is, everybody knows where their tension is, nobody realizes where it's coming from. And so, basic functionality of our body is there's a push and pull stabilizing system going on. You got those front muscles, which are the strong muscles, and they're actually where everything's coming from. And what you consider core muscles, that really needs to extend the comprehension, because we're thinking that abdominal is core when pectoralis should be included. So with that being said, all of our body tension, as far as the tension that we feel on a regular basis that most of us complain about, are actually coming from three zones up front and just being reflected in the back. So with that being said, all of your neck and shoulder tensions pretty much are just coming from the pectoralis themselves. So I'll show you on myself, of course. Here, base of your neck to your shoulder blade. Base of your neck to your shoulder blades. That's all coming from up here. When these muscles get too tight, they pull you forward. Those stabilizers are getting way too much tension, way too much work, and they have to be released. The next thing, mid-back. Thoracic, pretty much going into the upper lumbar, we'll say that. So, everything underneath your shoulder blades, coming down just above your waistline. Look at the front of your body. That's here to here. So pretty much everything as far as your abdominal tension and all of your digestive situations reflect themselves in the back. So if you've got gas, constipation, dehydration, you've got too much tension from sitting, driving, lifting, all of those different things, these are the muscles that activate. Those are the strong muscles, and the muscles in the back are only stabilizing to pull you back to the upright position. Last situation, zone 3, are going to be at your hip stabilizers, your hip flexors, and your lower abdomen. So the lower portion of your digestive tract is just as much as relevant and responsible for your lower back tension as those hip flexors are. So if you've got any gas or anything settling in that particular portion of your stomach, any bloating or things of that nature, which we generally get on a regular basis, those are things that need to be addressed. It's not just something that's going to be gastric, it's going to turn into a physicality. So with that being said, stretching, fiber supplements, and anti-gas agents, those are the three things that I recommend for the most part. And when I say stretching, I don't mean stretching your legs. That's important. But stretching out your pectoralis muscles and making sure that you stay open and keep those things extended. Making sure that your abs are always extended and always open. Get those muscles stretched out. Your hip flexors as well. So we're going to get technical for a second. Psoas muscle comes from the bottom of your rib to the top of your hip. And that needs to stay open just as much as the muscles that are all around it that we think about as our abdomen. So, with that being said, you could actually have massage done for these things. You could have, well, that's the best option, honestly, to have the gas pushed out in the same pattern as your digestive tract. And that goes up the ascending on the right-hand side, across the transverse, think of it rib to rib, down the ascending, down the descending on your left-hand side, only to the level of your belly button. And then you come into center just under, and you finish your cycle. And you start again at the hip flexor going in that same pattern. That's going to help push gas along. It's not going to be comfortable at first. It's going to get a bit burpy, possibly even flatulent. But the fact of the matter is, these are things that need to happen. And once you stand up from that process, I guarantee you, you're going to feel like you're standing straight up without any effort. It's like floating back up to an upright position. But generally, we're being tilted forward and pulled forward, at least slightly, by those muscles or by some gastric discomfort that's there. So addressing all of those things and flexing, lunging, stretches, those type of things for the lower portion of your body. If you're a yoga enthusiast, there's things like cobra pose for you, pigeon. But for the average individual, just do a back bend. Stand at the wall, give a push, get some stabilization, and then try and back bend against the wall to stabilize your shoulders. And that way you have balance and you can open up that core just as much. So with that being said, when it comes to a close, hopefully I help the therapist and someone else, and have a great day. That's what I have to give right now for MH Wellness.